Good evening, and welcome to another installment of Children First. In this program, we tell you about services that are available to children and their families. And I'm happy to be presenting a program this evening that's provided by Maryville Academy. Our dedicated staff work with some very special children and their families, and I'm asking Mary Argo first, and then Nina Laprandi, to tell us about this program. So Mary, would you tell the audience first, please, a little bit about your background?
Well, sister, I am a registered nurse. I have been a registered nurse for almost 31 years. I have a master's degree, and I specialize in pediatrics for the last 15 years. I look at working with medically fragile children. These are children that are either tech-dependent in some way, which means they need some kind of life support in order to sustain their life. They need nursing care 24 hours a day.
Mary, how long have you been at Maryville Academy?
Trick question, actually. I've actually been an official Maryville family member since 1999. However, I started off the Children's Memorial Healthcare Systems, which was in a collaboration with Maryville for over 12 years, running a medically fragile program for DCFS wards, where I stayed there for 8 years. So technically, I've been around 15 years.
And we're happy you have, Mary. And let me ask you, you were one of the visionaries who helped start the program we're talking about tonight, the Children's Healthcare Center. Can you tell us how this idea came to be, and what is the purpose of the Children's Healthcare Center?
The Children's Healthcare Center actually stems out of the Alternative Children's Act, which is a act that allows children that have disabilities and medically fragile issues to stay at home, to be active, to be a part of the community. Our program is there for children not to be institutionalized for the rest of their lives, but to be an added part of with their parents to take care of them. We provide education and quality care of teaching to their parents, their caregivers, their siblings, on equipment and on their skills in order to keep them home. These children a lot of times do not get this kind of training in the hospitals. The training that we provide is on the equipment and with the nurses that they will actually be working with in the home. And because of this, our children tend not to get readmitted. Parents are more reassured about the care that they're giving, and overall the kids do a lot better.
So, Mary, let's just help people understand the process here. First of all, a child's diagnosed with a condition that you're talking about as medically fragile. What kinds of illnesses are these?
Oh, it could be anything from a very premature baby that is in respiratory distress or just needs time to grow, can't eat. It could be a child that's been in an accident. We've had several of those. It could be children that are born with chronic illnesses such as muscular dystrophy, multiple sclerosis, cerebral palsy. Pretty much anything goes.
When you say premature children, how small are we talking about?
I think the smallest one we've had actually was a 26-weeker, which means they could pretty much fit in the palm of your hand. These are very fragile little children. They're almost iridescent in coloring. 10, 15 years ago, these children wouldn't even survive, and now we're getting them home, and we're getting them as healthy as we can.
So we're blessed that these little children have come into this world. Their families want to take them home, but they need some additional help with their care in these early days in order to be prepared as parents to take their children home. Is that what we do with the Children's Healthcare Center?
Absolutely. These parents are scared, and I don't blame them. I mean, you're expecting a perfectly healthy, full-term little baby, and then you get this little baby that's half the size of what you're expecting, cannot eat by itself, can barely hold its arm up, and they cannot take them home. They're afraid. We give them the reassurance they need to take care of their kids and to be good parents, which they are. They just need somebody to give them a little extra time to learn. Unfortunately, nowadays, that's not an opportunity in the hospitals. They tend to get discharged right away, or they don't get to interact with their children in the NICUs. We allow this. We allow them all the time they need to get them home and to get comfortable with their kids.
And how long do children usually stay at the Children's Healthcare Center?
Well, it all depends on the child themselves, the individual child, and their diagnosis, but they can stay up to 4 months under transitional care, which allow us to give them all the training and the teaching they need. But during that time, if they have any readmissions, any surgical procedures, we start over, because then it's new training.
So this is care that's covered through different kinds of insurance?
Yes, it is covered through the State Department under Medicaid and different insurances. If there's a child out there that needs our services, we're happy to work with them, to contract with them.
And Mary, when the parents come, do they spend some time learning how to perform these different kinds of care for their children?
Oh, absolutely. In fact, we actually start on mannequins and not their children themselves. It's very easy for a parent to work with equipment on a doll and get very comfortable with the equipment first and then move on to their own child. It gives them a sense of reassurance that they're not going to hurt their child in any way.
And by the way, where is this healthcare center for children?
Our Children's Healthcare Center is located at 4015 North Oak Park Avenue in Chicago, which is directly east of the Harlem Irving and Mall.
And we're going to show at the end of this program, we're going to show a telephone number and, of course, the Maryville Academy web address for anyone who wants to contact us about this program if families need the services. Mary, can you tell us, we're about to show a video, but there's a charming story, a heartfelt story about one of the young ladies in this video. Can you talk to us about her?
Yeah, we're going to call her Maria. Maria has actually been a very special child to the Children's Healthcare Center. She's been with us for quite a while, which is a little unusual, but there's a lot of good reasons for it. She came to us at barely 7 months of age, which a lot of people would think is very old, but she was indeed one of those very special preemies. She was a little over 10 weeks premature. She had severe respiratory trouble, she had severe intestinal trouble, and she had a tumor that went from the base of her throat to the base of her brain. Actually, they didn't think she was going to survive, and her mother was devastated and didn't think she was going to care for her and actually had given her up. It just so
had given up thinking she'd take her home.
Giving up thinking she would take her home, she was going to institutionalize her, and it just so happened that she ended up back in the hospital on a treatment, and during that time the hospital contacted us, and we managed to get Mom back into the program with us and working with her, and Mom's been incredible with her now. Little Maria has had 7 surgeries. She has had the tumor resected several times, and she still has a trach, but she's no longer vented, and she's no longer on a lot of different life supports. She has 2 more surgeries to go, and she's actually going home healthy.
And I can attest as a layperson who comes in the Children's Healthcare Center that she now walks around the Children's Healthcare Center kind of as our ambassador of goodwill. So let's take a look at the video.
This is my son Sean. You can take a look at him right now. He's just as healthy as can be.
She gets very excited about things like Blue's Clues and Dora the Explorer. It's just so energizing.
This is my son, Mark. His friends love him. He's always had a lot of friends. Very giving. He loved to play with his Xbox, Nintendo.
Tori is, she's always ready when I come. They have this classroom set up for her, which is really nice. And she has come back to school now. And Monday was her first day, and it was like she never left.
All of our hopes and aspirations as parents are oftentimes for our children. You think your world is going to be a certain way once that baby comes, and then boom, you deliver a child and you have somebody in a white coat come and tell you there's a problem with your baby.
She just came out and said she's got Down syndrome, and I was deathly afraid of what was going to happen next.
Without Maryville, I probably would have a nervous breakdown by now. I needed their help, and I'm so glad they were here for me, and Mark.
The Maryville Children's Healthcare Center was open to provide respite and transitional services for parents and children with complex medical needs.
All right, lady, let's go.
The center offers temporary relief and support by providing primary caregivers up to 14 days of respite services and up to 120 days of hospital-to-home transitional care for medically fragile children and their families.
Every year there are more and more medically fragile children. Every year technology is allowing us to save children that couldn't be saved before. And with that come a lot of training issues.
We receive trainings, as I said, from the companies for each individual piece of equipment because everything changes. Now, we in turn make sure that our families not only can handle the equipment, but that they feel comfortable caring for their child with the equipment.
When you have a baby with some special needs, you need a little instruction. They made sure I knew what I was doing, and so did she when we left. They made sure that any medicine that he was supposed to be taking was taken properly and showed us how to distribute it once we got it home.
The Children's Healthcare Center is a very necessary part of the continuum of care for healthcare services. There are children who are ready to be released from a hospital setting. They're no longer acute. However, taking care of them in a home setting can provide some pretty severe challenges for families.
You know, I still needed to work. I still have other children, and I was afraid I couldn't meet her needs, which, as it turned out, I couldn't.
I had Mark home for a year, okay, and he had nurses coming in, and it was becoming too overwhelming for me because I only had nurses 12 hours a day, and that was while I was working. And when I get off work, I was the nurse, and I was about to have a nervous breakdown. It was just too much for me.
We really look at the whole family. We're not just taking care of a medically fragile child.
The facility actually helped maintain the situation. I myself was in a medical situation, I had leukemia, and they were just as adamant about taking care of Abigail when she came to the facility, being a big sister, as they did Sean being a resident here for the short time that he was here.
We listen to the children. We listen to the parents, the primary caregivers. We hear their needs.
We have a program, a homebound program, when the children are out for any length of time. The teacher comes for an hour a day so that they won't fall behind on their schoolwork, or in Tori's case, so they won't regress or lose some of the skills they already have.
The same way they would be visiting that child if that child was at home, they can come visit the child here.
We're the family advocates. We're the educators. We're the caregivers, the supporters. These families, these children are not our patients. They're our extended family members. We're right there with them every step of the way.
Que aquí es un buen lugar. Llega uno a la casa y sabe que aquí está bien. La niña y hasta ahorita está creciendo y se está viendo el cambio.
This is a very safe and secure setting that any family can feel comfortable bringing their child. We ask the parents to give us a list of who the children can visit with, so we know exactly who's approved to come in and out of the building when the family members aren't here. Every visitor that walks in the door signs in and signs out.
Being a newborn father and also watching my wife go through bone marrow, through chemotherapy, and my son in neonatal in the same hospital, I was really, really reluctant to give him up that fast to somebody who I didn't know, didn't trust, But after I came toward the facilities and seeing really what this place was all about, I would highly suggest, if you're in need of their services, truly, that this would be a caring and giving place to leave your children.
The Children's Healthcare Center. And now we're joined by Nina Alaprandi, and Nina is the division director who works with Mary Argo, who was just in our program, and with other program directors at Maryville Academy. And Nina, in this particular program, the Children's Healthcare Center, can you talk about your background, how you're prepared to help work with the children and the families?
Sure. Well, I'm not just the division director for this program, but I'm also the mother of a medically fragile child. I have a 9-year-old daughter that, although she was born in a presentation that we thought was healthy, as she began to develop, we realized that she had some significant delays, and despite many efforts to find out exactly what was wrong with her and saw many subspecialists, she still to this day has no diagnosis, but at 9 years old is not independently walking, talking, or even chewing. So like many of the families that we work with at the Children's Healthcare Center, I myself live in a world of doctor's appointments and therapy appointments, and so I feel like I can really relate to what a lot of the families are going through.
So since you have that understanding, Nina, can you speak right to parents right now of children with these special medical needs? What do they need that the Children's Healthcare Center is intended to help them with?
Well, First of all, sister, there are many children who are sitting in hospitals today that are really beyond medical necessity. And as Mary spoke earlier, because of a lack of training on the equipment, the technology that some of these children are attached to, the families do not feel comfortable and safe bringing them home. A secondary issue is that some of these families need to have some modifications done to their homes. There are many children who are growing up healthy and living very normal lives, and then due to some sort of an accident or an illness, they find themselves in a situation where they're now faced with a child who may be now attached to some technology or in a wheelchair, and so now they need to have some modifications done to their home so that they can be able to safely care for those children. So the Maryville Children's Healthcare Center provides a very safe, very nurturing place where families can feel very comfortable bringing their children. They will receive an incredible amount of training on how to care for those children while they're at home. And additionally, for those of us who do have children with a lot of special health care concerns, our children are visiting many different subspecialists, sometimes not all in the same hospital. So it can be very overwhelming for family members just to learn how to navigate the community and maintain all the appointments they need to go to. So one of the things that our nursing staff and our certified nursing assistants do is they will help transport, along with the parents, these children to their follow-up appointments while those children are living with us. So there are relationships that are being formed between the family members and those who are going to be caring for the kids once they come home.
Nina, let me stop you for just a second. I understand we have a caller who perhaps has a question about what you're saying. So let's have the caller.
Hello.
Good evening.
Hi. Thank you for taking my call. I was watching your program, and I guess I really had two quick questions. The first is, what is the criterion to have a child enrolled in Maryville Academy? Like, what medically, what's the criteria? And I guess the second question is, would there be any way that perhaps I could drop off my child and then pick him up, like when I'm finished from work, or would he have to be there full time?
Nina, would you like to address these two questions?
Sure. At the Maryville Children's Healthcare Center, we offer two different levels of care for children. So one level would be respite care, and that's a situation where a family member could make arrangements to drop their child off for anywhere from 24 hours up to, however long we would talk with them about what it was they were going to needing to be, the length of stay would be. And that care, the parents, would drop their children off and wouldn't stay with us. We also provide transitional care, which is hospital to home, up to 4 months at a time, and that's for those children who are beyond medical necessity but not yet ready to go home. So at this point in time, we are not providing any kind of medical daycare, which I think is what the caller is asking about. In terms of the types of children, as Mary referenced earlier, we cross many different diagnoses, and we work with children from birth through the age of 21.
Now, Nina, I think in response to the caller's question, maybe you could explain what we mean by respite care.
Respite care would be a situation where a family member could make arrangements so that we could take care of their child for up to 24 hours or for a weekend, or if a family member had some sort of a medical emergency or had to leave town or just needed some days where their child would be in a facility where there are very trained, nursing staff to be able to meet that child's needs so that they could get some even rest and relaxation or spend some time with other family members. Those would be some reasons why family members could use us for respite care.
Well, thank you about that for that explanation, Nina. I think we want to emphasize this is one of the programs that Maryville Academy offers for children and families. We wanted to spend the entire program this evening on the topic of the Children's Healthcare Center so that it would be very clear what services are available to families with these very special children. And at future times, we'll talk about some of the other programs. But since we have Nina here and we've just seen the video, Nina, I want to ask you, what would you say the families, as they're leaving with their children and then they come back and they're in touch with the Children's Healthcare Center, what do they say are some of the most helpful services or educational opportunities that they've had from the Children's Healthcare Center?
Well, it's quite interesting because I can tell you that many of our families do keep in touch with us. They call us back. They feel very safe and very secure that they understand the equipment and the procedures that have to be done with their children. And many of these families will have nursing support when they go home with their children. So they may have a nurse come in 4 hours a day, some 8 hours a day. But in those hours where there is not a nurse coming into their home, they are the nurse, as you heard one of the mothers in our video say. So they've been very clear with us that they feel very, very equipped. Many of our children are on ventilators or have tracheotomies, and so there are different ways that you have to care for their equipment. And you know, when the bells and whistles are going off or an alarm is going off, it can be very scary if you're not familiar with that particular piece of equipment and what those alarms mean. So the families, I think one of the most significant things is that they feel very secure. Secondary to that, because when we discharge a child home, we really have created a seamless continuum of care so that all of those subspecialists, any of the therapists that may have to come into a home, for example, some of our children have occupational therapy or speech therapy or feeding therapies, physical therapy, all of those relationships begin while that child is with us. So the clinicians who will be treating the children at home are treating them while they're in our facility. It minimizes the crisis when the kids are at home.
Thank you, Nina. And I want to thank Mary Argo also for being part of our program. And what I'd like to do is show our callers where they can reach us at the Maryville Children's Healthcare Center. So there's a general information number, as you can see, 773-205-3600, and also our website at www.maryvilleacademy.org. Our programs, our services are about helping children and their families, and as you can see, this is one of Maryville's programs to help keep families together by providing them the supports they need at this time. So we thank you all for being part of our program this evening. Good evening.